And maybe as a short guide for young students who are just halfway up their education, what would you advise them? What is the most efficient to focus on? So what should they focus on to learn materia medica? What would you advise them?
Frankly to say, when I was a student, I was trying to put as much materia medica in my head as possible. Yeah. And of course this is important. But now, after so many years, I find that the most important training for the students is to teach them how to get the data, how to observe the patient, and how to get the priorities. To be clear of where they are with the patient and where it's possible to go. Not to create imaginary ideas that with one click you can remove all the problems and you can make a quantum leap, 4 levels at once. It happens sometimes. I have these cases also, but they are not everyday cases. And for everyday practice, it's really very important to teach the students how to think.
You mean what is peculiar in the case and what is realistical of what you can realize?
Yeah, just when the patient comes, you have medical information, you have family dynamics information, you have miasmatic information, you have past history. So how to put all these things on the right places and not get things which not belong together in the current moment, because this is where students are lost. They know they have to collect all the information, but when it comes to select what is the...
You mean that they confuse information from the whole history?
Yeah, they confuse the target, they confuse the... many of them don't see the right links between the events, and they go in the wrong direction. I mean, they start to approximate very early, and they lead the patient in an... They put in his mouth some expressions. So this is the classical approach, to be unprejudiced, to find what is actually...
At this moment?
At this moment.
What is the presenting
What
symptoms?
has to be cured at this moment.
At this moment, okay.
At this moment. And what is the best way to start. And if they know this step by step, they are getting steady results. And by working, they learn materia medica. Because otherwise, they can learn a lot of materia medica, but then they get confused with the patient. How to see, they can see sometimes 1, 2, 3 pictures, 3 layers, sometimes, yeah? They don't know how to understand the current problems and what is the right thing to start with. So it's philosophy, it's just life.
And you mentioned a while ago the remedy carcinosinum. You use very frequently the nosodes in your practice, or you use them at a certain time in a case? Or?
I use them both ways. Sometimes I have patients and I see there is a lot of anamnesis in the family. So I might think of having it written that I will think about carcinosin at some moment. But there are also many cases when carcinosin is coming as a first remedy, is coming as a picture. And according to me, they are getting more. These cases. Yeah, I have some even small children, and I'm looking for another remedy, and finally I say, no, it's really carcinosin, and it's really carcinosin, and they get very good results.
And when you prescribe a nosode as first remedy, does it complete the case completely, or do you always need to follow up with other remedies? So if you
both. Sometimes it is enough. This is the remedy, and for a couple of months, the patient doesn't need anything else. According to me, this idea that you give once a remedy and the patient doesn't need anything more further in life is a wrong idea, because there is life is always moving, and the situation around the patient is always changing. And if he is getting into trouble because his boss is very angry, and or there is some loss in the family, or there is something else, at this particular moment, this patient needs certain homeopathic help. It will be acute remedy for this period of time. Grief, stress, anger, loss, or if this is a person who is in the let's say a businessman who is working a lot, you give him nooks, he's okay, 1 month, 2 months, then he's coming back. It doesn't mean that you have to change the remedy. It just means that this system cannot support and stay in this good, healthy state, because there are too much environmental factors who are putting load over the patient. And I think this is also a very important message for the students. Not giving them the wrong ideas. Homeopathy, one needs as much as it happens in certain periods of time in his life. Or it's a child, if it is a child, while developing, while going through different stages in his development, or while he's having different problems, we have to be adequate to the time when the problem happens, to the stage, age, and to the family dynamics at that particular moment. And then we give them help for that particular moment. And then it's okay for another couple of months. So it depends from the patient and from the situation. I have patients who are coming regularly. They feel like that, coming every month or every second month. But I have also patients whom I see once every 3 months, or twice a year, or I don't hear about them long time, 2-3 years. I think I have not helped them and they left. Then I understand that they were just okay and they didn't need any help. So it depends. To be a good homeopath means to be very flexible.
So, okay, Dora, thank you very much for this interview. And,
thank you, René.
I hope to see you maybe in the Netherlands or somewhere else.
Okay,
soon. Thank you.
With pleasure. Thank you. Bye.